Good afternoon to all. Myself is Anusha. I am working from Emmanuel Also College of Nursing. Today we are discussing about nosocomial infection. Introduction. Nosocomial infection comes from Greek word nosis, meaning disease, and commune, meaning to take care of, also called hospital acquired infection. Infection are considered nosocomial if they first appear 48 hours or more after hospital admission or within 30 days after discharge. Rise in nosocomial infection as a result of four factors: crowd hospital condition, new microorganism, increase the number of people in compromised immune system. Epidemiology. Nosocomial infection can be exogenous, external organism, and endogenous, opportunist, normal flora. Hospital susceptibility is an important factor in the development of nosocomial infection. Mode of transmission. There are five main mode of transmission: contact, vector-borne, airborne, droplet, common vehicle. Droplet transmission. Droplet generated by a sneezing, coughing, or respiratory tract producers like a bronchoscopy or suction. Vector transmission. Transmission through insect and other invertebrates animals such as mosquitoes and flies. Airborne transmission. Tiny droplets nuclei that remain suspected in air. Common vehicle transmission. Transmitted indirectly by a materials contaminated with the infections. Contact transmission. Most important and frequent mode of transmission of nosocomial infection is divided into two subgroups: direct contact transmission, indirect contact transmission. Direct contact transmission is a direct body surface to body surface contact and physical transmission of microorganisms between a suspectable host and an infected or organized person, such as occur when a person turns a patient, give a patient a bath. Indirect contact transmission involves contact of a susceptible with a contaminated intermediate object, usually inanimate, such as contaminated transmissions, needles or dressing, or contaminated gloves that are not changed between the patients. Agents of nosocomial infections: virus, bacteria, fungi. Common infections. Following are most common nosocomial infections: urinary tract infection, catheter associated infection, pneumonia, bloodstream infection. Problem of nosocomial infection. Nosocomial infection will become more important as public health problem as it causes nosocomial suffering, prolonged hospital stay, increase the cost of care significantly. Surgical site infection. They are also frequent. The definition of mainly clinical pleural discharge around wound or the insertion site of drain or spreading cellulitis from wounds. The infections can be exogenously or endogenously. Nosocomial pneumonia. The most important are patients on ventilation in ICU. Recent and progressive radiological sites of pulmonary parenchyma, pleural septum, and recent onset fever. Urinary tract infection. It is the most common cause of nosocomial infections. 80% of infections are associated with indwelling catheter. Prevention and control. Prevention and control of nosocomial infection can be done by the following ways: isolation, designed to prevent the transmission of microorganisms by a common route of hospitals, because agent and cause factors are more difficult to control. Interruption of the transmissions of microorganisms is directed primarily at transmission. Tell your doctor everything. All symptoms, previous disease, other alternative treatment, other over-the-counter medication. Conclusion: there is no official national approach and no real managerial support from the authorities of nosocomial infection. Only thing is prepare asepsis, prepare hand washing and sterilization. Thank you.